Hello, my name is Lizzie. I'm part of the Girls Are Powerful Youth Advisory Board. This is our COVID-19 community interview, and I am here with...
Hi, my name is Caroline Kuria. I am a psychiatric nurse practitioner. My area of expertise is in psychiatry.
All right, so thank you for joining us today. Thank you so much for taking the time out of your day. Really appreciate it. So tell me a little bit about your profession and area of work. Why are you passionate about it?
I am passionate about it because I believe, like any other health issue, that mental health is one of the most overlooked. And it is an equation that must be completed to attain whole health. So I'm passionate about doing that. I'm passionate about serving my community. And I'm passionate about educating people on mental health issues.
How do you personally tackle stress and anxiety when you go into your workplace?
Wow, that's thank you for that question. It's quite a huge one. Well, couple things. I work in a very stressful environment, given that most of my patients come to me when they're not doing well, when they're distressed, when they have their own issues, stressful situations going on, and they're looking for a relief. So that alone in itself is stressful. Then there's the added stress of the working environment. As you know, I work both in a hospital and in a clinic, and that comes with its own challenges. So number one, I try to leave my own personal stress at home. So when I go to work, I sit down and prioritize my day and decide what is it that I need to do first, what can wait, what is urgent, what is not. So that kind of early planning helps me go through the day a little bit more easier. And sometimes, because of the nature of my work, we can have unpredictability. So not necessarily knowing how your day is going to be, but it helps a lot when you plan ahead and try to leave your stress behind.
That's good. So thinking about mental health, are there any activities and or strategies that you would recommend to people to help them balance out their stress and anxiety on any given day?
I'll just share what works for me, because I believe experiences shape the future, and shapes and also considering science and everything in between there. So number one is to know that you can do it all. Is to give yourself credit and give yourself enough time for grace for stuff that cannot be done. The other thing I like to do is to just sometimes look for a moment to be by myself and spend a few minutes just to relax, just to be by myself, and just my own little moment, even if it's for half an hour, because that is very, very helpful for me. The other thing is I try to vent. I connect with people who understand me and share how my day was, so that I can relieve some of the stresses that I have. And then I also try to do something fun. In the midst of a busy day, I think it's important to also do something fun.
So why does people's mental health matter more? Why is it more important now than before?
Well, I would not say that it is important now than it was before. It has always been important. It's only that it has been overlooked or squashed somewhere in a corner. But given the current situation we are facing, we are in a pandemic, and people are more isolated because they must be. They're quarantined so we can mitigate the virus and stop the spread of the infection. So what that creates is a perfect storm for mental health issues: depression, isolation, loneliness, suicidal thoughts, because people are isolated. They are away from being together with people where they find their support system, and that can create a perfect storm for depression, anxiety, suicidal ideations, and especially the anxiety of being in a pandemic and a virus that is still not well known. We don't know what the future looks like. that can affect people's mental health issues. So right now, more than before, we need to pay particular attention to mental health issues for people already with pre-existing mental health issues and for people who don't, because those issues can start right now. So what I encourage people to do is, yes, we are social distancing ourselves, but we don't have to be socially distanced. We can be physically distanced, but you still can connect to people via Zoom, via, telephone calls, Facebook, whatever social network that is healthy for you. I encourage everyone to do that.
Yeah. What are some ways that people could remain positive when there's so much going on around in the world?
There will always be things going on in the world. Unfortunately, that is just what life is all about. But number one is to be grateful for the little things. We woke up, we are breathing, we have good health. Well, we have food, we have shelter, we have connections, we have friends, we are healthy. There's so much good around. We just need to look and experience it and not focus on the negative things. If it is in the news, there's a lot of negativity in the news. Take a break from that. Take a break from the negative news and connect with a friend, check on a friend, serve your community in whatever capacity you're able to, no matter how young or how old you are. There is something about giving back to the community that gives you joy. So there is a lot of good around us. We just need to look around and appreciate the trees, the flowers that are blooming, the wind. We just need to look around and see the good stuff that is around us, and that, rather than focus on all the evil in the world.
Do you have any available resources or outlets that you'd like to share with people that are looking for those?
There's a lot of resources out there for people of all age groups. There's NAMI Minnesota, the Organization for Mental Health in Minnesota. It is a national-wide organization, and in Minnesota, there's a branch for that. When you go to NAMI, you will find a place for the youth. If your focus area is that they cater for the youth and do stuff like that. There is also the SAMHSA, which is the substance abuse website that people can go and get resources there. Minnesota Department of Health is a mental health section there. Mayo Clinic, local churches have a good source of that. North Point Clinic is one of them. Destiny Hill Church is one of them. And just going to, those are three places I would encourage people to go through there, because in those three websites, then there's so many other resources. The Minnesota Suicide Hotline is a resource for anybody that is feeling lonely, feeling that they've given up. They can always go there. I could share with you, write down for you those sites so you can have those resources and share with your friends. But there's quite a bit of those out there, so people should not feel alone. They can reach out to me. You can give them my contact information, and I can direct them to the right places.
All right, thank you so much. I've reached the end of my questions that I've had for you.
Thank you. It was a pleasure to have me around. Thank you so much for the invitation.